Welcome to Noon Wednesday. I'm Marissa Wojcik, multimedia journalist with Here and Now on PBS Wisconsin. Today is December 8th. As we close in on the end of 2021 and the second year of this pandemic, we've gone from introducing warp speed vaccines and thinking we were heading toward a reprieve in this pandemic to an even worse surge from Delta, the first big variant to take hold. And now, over the last few weeks, we have begun to learn about the next variant of concern, Omicron. Here to help us unpack how this looks is PBS Wisconsin reporter Will Cushman, who writes our weekly COVID condition. And Will, thanks so much for joining.
Hey, Marissa.
So how many cases of Delta is Wisconsin averaging right now?
Yeah, that's been a little hard to track down in recent days. The state health department has been dealing with some data issues after performing some sort of upgrade to its disease reporting system over the weekend. And so we don't really have detailed data since last Friday, but I did get some kind of high level stats from the Wisconsin Department of Health Services this morning. And right now we're averaging about 3,100 or so confirmed cases every day. That's down a little bit from the end of last week when the average was about 3,500. But we're also averaging around 500 to 600 probable cases every day as well. And I want to note that the number of probable cases that we're seeing lately has been really high. In fact, kind of at its highest levels throughout the whole pandemic. And we think that's because probable cases are determined usually via rapid at-home antigen tests versus confirmed cases, which are determined via a PCR test. So if you go to the local health department or your doctor to get tested, you're probably getting tested via PCR test. It takes a couple of days usually to get those results versus the rapid at-home test. And so we are seeing this fall. It seems there are fewer people getting the PCR test compared to the big surge last fall, but there are definitely, it appears, more people taking advantage of the rapid at-home antigen tests. And I should also note that the number of probable cases that we're seeing on average every day right now, about 500 or 600, is very likely a significant undercount because there are likely quite a few people who are getting positive results from their at-home tests who are not reporting it to their local health department. So it's not getting fed into the state data system.
Very interesting. So likely an underreporting all around, and testing overall is very different from last year. But something that we do know more concretely is hospital capacity. What does that look like statewide?
Yeah, so as of yesterday, there were more than 1,600 people hospitalized around the state for COVID, including more than 400 people who were in intensive care units, so in ICU beds. That is up significantly even over a week ago. That's about 15% higher than just 1 week ago. And the Wisconsin Hospital Association is reporting that there are not very many beds left in the state for anyone, whether you're a COVID patient or there for treatment for something else. There are right now only a little over 30 ICU beds available all across the state, and most of those are located in southeast and south central Wisconsin, so around the Milwaukee and Madison metro areas. There's a huge swath of Wisconsin from along its western border from Richland County in the southwest all the way up to Lake Superior, including La Crosse and Eau Claire and Superior and Barron and the Twin Cities exurbs, where there are 0 ICU beds available, or at least there were yesterday. And then in the Fox Valley, there was 1 ICU bed available. In northeast Wisconsin, centered around Green Bay, there was only about half a dozen. And then in north central Wisconsin, including the Northwoods and Wausau, there were only a handful of ICU beds available yesterday.
Wow, so very, very limited capacity, it sounds like, all across the state. And hospitals have been saying that sometimes capacity not only is beds, but staff. COVID patients take more staff in order to take care of them. And so not only is capacity tight with physical space to put these patients, but actual staff to take care of them. So what are the major hospitals or just hospitals in general saying about what they're experiencing? What is word on the ground?
Yeah, that's a really good point. That a big part of the problem right now with healthcare capacity is in staffing. And yesterday I listened into a roundtable with some hospital CEOs from around the state hosted by Wisconsin Health News. Included the CEOs from Marshfield Clinic and Theta Care in Northeast Wisconsin, I believe Ascension, and then Froedtert Hospital in the Milwaukee area. And they all said very similar things. At Froedtert, they said they're full, period, at the moment, and that their ICU is filled with about a third of their ICU is COVID patients. The hospital CEO or president there, Eric Conley, said that about 88% of their COVID patients right now are unvaccinated. And that stat kind of holds up everywhere around the state, according to the CEOs who spoke yesterday. I believe Marshfield Clinic, they said about 75% of their patients were unvaccinated. And yes, they all said that this is a major strain for their staffs. It can take up to 3 times as many resources, including human resources, to take care of a COVID patient as it does for patients who come in for other kind of typical ailments, whether they're in the ICU or not. So it's definitely of concern, and I think it was the consensus was that the current situation is not sustainable from a staffing standpoint. And so hospitals are really looking for some relief in the near future, and we'll see if that happens.
Very, very alarming. So how does this compare to last winter when we saw a surge, but we didn't even have vaccines at that point? I recall we kind of hit some of our peaks towards the end of December, early January. How does this year and what we're experiencing right now compare to where we were at this time last year?
Yeah, at least in terms of hospitalizations, the current number of people who are hospitalized, a little over 1,600. That's about 70% of the peak number of hospitalizations that we saw during our worst surge last late fall and early winter. And that tracks with what hospitals are seeing on the ground as well. At Marshfield Clinic, the CEO said they right now are seeing about 75% of the number of COVID patients that they were seeing a year ago during the worst phase of the pandemic for them. So it's approaching those, it's clearly at crisis levels, and it's approaching the basically unprecedented levels. It's approaching what we saw at the worst peak last winter.
And you touched on how many people were vaccinated and percentages in some of these areas across the state where we're reaching capacity levels. NPR recently looked at counties' political affiliations against the impacts of COVID and found that areas that went for Trump are experiencing more deaths caused by COVID-19. Does this have to do with vaccination rates and taking precautions like distancing and masking? And is this what is happening in Wisconsin?
Yeah, that does seem to be the case. The NPR report that you're referencing, I believe it was looking at death rates since May. So basically since vaccines have been pretty widely available. And yeah, there does indeed seem to be, or there is a pattern that we're seeing, including in Wisconsin. I was playing with, NPR has a little infographic that you can enter in county names and look at death rates since May, along with their vote tallies from the 2020 election. And you can see a pretty clear pattern that places that, yes, went for Trump have had higher death rates since May, including in Wisconsin. And we know that there's definitely a political component to the willingness to get vaccinated. We know that now, actually, that the NPR report included an interesting stat that Republicans or Republican-leaning voters are now make up a majority of those who remain unvaccinated in the U.S. And so that's a pattern that we're seeing all across the U.S., including in Wisconsin.
And so now we have another concerning variant circulating. How many cases of Omicron are in Wisconsin that we know of?
Yeah, so I heard from the state health department just this morning that they're still only aware of that one case of Omicron that was detected in an individual in Milwaukee County last week, actually over last weekend. That individual had recently traveled to South Africa, where the variant was first detected and where it really is blowing up first. And in addition to that, we are also aware of several cases of associated with Omicron in people in California who had attended a wedding in Milwaukee County just after Thanksgiving. And are believed to have possibly been infected there. But so far, there's just that one case that the DHS is aware of in Wisconsin. But even last week, before the first case of Omicron was confirmed in Wisconsin, Dr. Ryan Westergaard, the state epidemiologist for communicable diseases, he told reporters that it is probably safe to assume that Omicron is spreading around Wisconsin, as it is likely spreading around most of the world at this point.
So what do we know about Omicron? What are public health officials saying about it? Should we be concerned at this point as we are in the midst of a huge surge of Delta?
Yeah, that's last week, there was definitely quite a bit of emphasis on the fact that, yes, Omicron is concerning. But we in Wisconsin and in the upper Midwest generally are in the midst of a really bad surge caused by another variant, Delta. So health officials were very clear that we should not lose sight of the fact that the present situation is not good as it is, even without this other concerning variant. And state health officials have said that they are concerned about the potential increased transmissibility of the Omicron variant, but it's still early in terms of the scientific understanding of the variant, and scientists still have to pin down exactly how transmissible it is. It does appear that it likely is even possibly more transmissible than Delta. But there's still a lot of questions about its ability to evade prior immunity, whether through natural infection or vaccination or a combination of those two. We know that what made Omicron so concerning at the outset was the large number of mutations, especially mutations that code for the spike protein, which we know is how the coronavirus, SARS-CoV-2, which causes COVID, infects people. And so there's worry that all of those mutations might make the Omicron variant better at infecting people. And there does seem to be some pretty limited lab-based data so far that the Omicron variant is potentially better at evading both prior infection and a two-dose regimen of Pfizer, at least some form of vaccination than previous variants were. But that's lab-based evidence, so it's not really real-world evidence that we're able to assess yet. But it is definitely of concern, and we are seeing a pretty rapid rise in cases in South Africa, where the variant first was identified, along with now a rise in hospitalizations. And whether or not Omicron is responsible for milder disease than Delta or other variants is still an open question. There's still a lot of open questions related to this variant, and I'm sure we're going to be finding out a lot more over the next couple of weeks.
And I believe even just this morning, Pfizer said that 3 doses of their vaccine is a much better, 25-fold better protectant over the Omicron variant. So very much evolving information as we learn more and more. Given that, we have a major holiday that typically involves a lot of travel coming up. Christmas is just around the corner. This is typically a time people take a lot of time off. College students go back home. People will travel very far to be with family. Should people be modifying their plans? Have there been any mandates put in place? What can we expect, and what is the safest thing to do?
Yeah, that's a really good question. Here in the US, there haven't been a ton of new mandates or restrictions put in place yet to respond to Omicron, aside from more stringent testing rules for people who are entering the US from abroad, including US citizens. But yeah, I sat in on just a kind of Q&A for reporters that Mayo Clinic held with a doctor late last week. And so it was before we even understand what we do now about Omicron. So it's very early in Omicron. But that doctor with Mayo was expressing that people should really be cautious over the holidays, especially if you are immunocompromised or elderly, or you have immunocompromised people in your life who you plan to spend the holidays with. He suggested taking precautions, of course, first and foremost, being fully vaccinated. Now, if you're an adult, getting a booster shot. As you said, there's early evidence that at least a booster of the Pfizer vaccine may help protect against infection from the Omicron variant. But he also mentioned all of those kind of mitigation strategies that we're really well familiar with at this point, the sort of layers of protection. So masking up when you're in public places, especially in indoor settings. When you're traveling in the airport, you have to mask up when you're in the airport and flying right now anyway, but really making sure that you're being vigilant about that. Washing your hands frequently, distancing when you can. And then, yeah, with your holiday gatherings, think about kind of keeping them on the smaller side. Maybe, especially if you're concerned about your health status or that of a loved one or anyone in your life, maybe avoid large crowds and such. But I think there's also, and the doctor from Mayo acknowledges as well, there's definitely a hunger that people have to spend the holidays this year with their loved ones, especially after last year when it was even less safe to do so because most people weren't vaccinated. So he was definitely not of the opinion that you should cancel your holiday plans necessarily, but you should definitely think about those layers of protection and try to be as vigilant as you can about them.
It seems a lot of things have relaxed a bit since last year, and it's very difficult to bring those regulations back or to rein things back in. So people are definitely going to still be seeing family and friends over the holidays. As this continues to evolve and we go into 2022, what are you going to be focusing on most in your reporting? What are you kind of looking at closely as this continues to drag on?
Yeah, first and foremost, I'm going to be following closely, like a lot of people are, how the Omicron variant actually pans out, what its actual real world impact is going to be in Wisconsin and in the US. I think that's definitely what I'm going to be following most closely in the near future. But now I'm also going to be following kind of, we're approaching, believe it or not, 2 years with this virus. And as you said, things have, in terms of restrictions, kind of relaxed quite a bit over the last 6 to 9 months since we've had widespread availability of the vaccines. So I'm interested in reporting on how healthcare in general is going to be just shifting maybe on like a permanent basis in response to the ongoing threat of COVID. This roundtable with hospital CEOs yesterday that I attended was some of the topics that they were touching on were pretty interesting. Just the unsustainability of the current situation for healthcare workers and for healthcare systems in general, I think is going to be something that we want to pay really close attention to over the next several months to years, for sure.
All right, well, Cushman, thank you very much.
Thanks, Marissa.
For more from Here and Now in PBS Wisconsin, you can visit pbswisconsin.org/news. And thank you so much for joining us on Noon Wednesday.